In this infographic, I have given information about how to use non-oral routes of medical administration, specifically nasal spray. On the first slide, I have just given the title and also a catchy interface, I believe. And on the second slide, I've given a very brief backstory in just two sentences to give an idea about what type of nasal spray that we are going to use, to administer in this infographic. And I've also added a picture of a sinuses person to make it more catchy to the viewer. On the third slide, I have used six square boxes, and I've included all the equipments that we need in those boxes. And I believe that it makes it makes it easy for the viewer to understand the equipment that we need to use. On the fourth and the fifth slide, I have included total eight steps of how to administer the nasal spray, and I've included made sure that I'm including only limited amount of pictures and avoided unnecessary use of pictures. So I just used total four figures for the steps, and which is to show how to sit comfortable in a chair, and also just to give an idea of how the nasal pump is like, and also to show how to use nasal pump into the nostril, which I believe would be useful for the person who is viewing this, and it would be easy for them to understand it. And on the sixth slide, I have listed about the after effects. So I have listed about the good effect, which is of course the relief from the sinuses, and also the side effects, which the person needs to understand. So I've given the side effects that will be coming with the use of nasal spray. And also I have included a specific instruction to look back on poll after 10 minutes, which I believe is very useful, so that the person needs to understand that we need to check back on the person after. And on the seventh slide, I have listed about the precautions and contraindications that are related to the nasal spray. So I have used a big picture of a stop sign to make it catchy for the viewer to understand that this slide is important and we need to stop and look at what is written in there. So I have listed about the situations in which we should not be using the nasal spray on the person, and also what we need to remember when we're doing the administration, which is like tilting the head, not tilt the head back, or do not take a big sneeze, things like that. And I have made sure it is written in two different sections so that the person can understand that these are important and these need to be noted. And on the eighth slide, I have talking about the DIPPS, specifically to the administration that we are talking about in the infographic, which is nasal spray administered to Paul. So for dignity, independence, and preference, privacy, and safety, these words I bolded to make it more visible to the person, and to demonstrate how to perform DIPPS while doing the medical administration and non-oral route of medical administration. And on the final slide, which is the ninth slide, I have included references. So I've used only two sources for the wall. For the wall presentation, so I've given the two references in the final slide, and so that's all about my presentation. Thank you.